Greetings, I'm Bonnie Lester. After overcoming 30 years of complex regional pain syndrome using the latest evidence based pain recovery strategies, I've completed advanced pain rehabilitation training and dedicated my life to sharing free pain education to help others improve their quality of life. Please stay with me for the next 5 minutes because understanding the difference between structural and non structural pain could be the missing piece in your recovery journey. I'll explain why some treatments work for certain people but not others, and how knowing your pain type can open up new possibilities for healing. If you're dealing with chronic pain, you've probably asked yourself more than once, what's actually causing this? Today I'm going to help you understand two main types of chronic pain that could be affecting you: structural and non structural pain. Let me start with a simple question. Have you ever had an x ray or an MRI that didn't seem to explain your pain? Or maybe you've heard somebody say, everything looks normal, but I'm still hurting. This is where understanding the difference between structural and non structural pain becomes really important. Think of structural pain like this. If you have a broken chair, you can see exactly why it's not working. That's structural pain. There's visible damage like a herniated disc, worn down joints, or torn ligaments. When doctors take pictures of these injuries, they can point to them and say, there's your problem. But here's where it gets interesting. Non-structural pain is different. Imagine your body's pain system is like a car alarm. Sometimes that alarm starts going off even when nobody's trying to break in. Your nervous system becomes overly sensitive, creating real pain without any visible damage. This includes conditions like fibromyalgia, certain types of ongoing headaches, and what Dr. John Sarno identifies as tension myositis syndrome, or TMS, also known as tension myoneural syndrome. Here's what's really important to understand. Both types of pain are equally real. Just because doctors can't see your pain or a scan doesn't make it any less valid. And here's something crucial to understand. Many people experience both structural and non-structural pain at the same time. For example, you might have an old injury that shows up on an x-ray, which is structural, but your nervous system has become overly sensitive, non-structural, amplifying your pain beyond the original issue. This is why understanding both types of pain is so important for recovery. In fact, pioneering work in this field by Dr. Sarno with TMS and even more recently with Alan Gordon's pain reprocessing therapy has shown remarkable results in helping people overcome structural pain. These approaches use the brain's natural neuroplasticity, its ability to rewire and change, to address how our brain processes pain signals. This science shows that for many people, pain can be maintained by our nervous system even after any original injury is healed. So, how do you treat these different types of pain? For structural pain, treatment typically focuses on the physical problem, things like physical therapy, specific exercises, or sometimes surgery when necessary. For non-structural pain, it's crucial to follow your doctor's recommended treatment approach, as different doctors may have different philosophies about treatment. Some doctors focus on medication-based approaches using drugs that target nerve sensitivity or help regulate pain signals. These might include antidepressants, anticonvulsants, or other medications that help calm an overactive nervous system. Other doctors take a more holistic approach, focusing on the pain neuroscience education to understand your pain system, lifestyle modifications, including sleep hygiene and stress management, gradual activity pacing and gentle exercise, mind-body techniques and pain reprocessing strategies, and cognitive behavioral therapies. What's most important is working with your healthcare provider to find the appropriate approach that works best for you. Some people respond better to medication-based treatments, while others find more success with mind-body approaches or pain reprocessing techniques. Often, a combination of approaches works best. Remember, chronic pain is complex, but understanding these differences can open up new treatment options you might not have considered before. You're not alone in this journey, and there are always ways to improve your situation. Thank you for watching. If you found this helpful, don't forget to like and subscribe for more information about pain recovery strategies and reclaiming your quality of life. Bye for now, and I'm wishing you a comfortable week.